country across the world. And there are 6 criteria that countries need to take into account when they are considering adjusting their public health and social measures or so-called lockdowns. We've already discussed that lockdowns can mean a number of different measures. The first criteria, and the DG has said this several times in his speeches, is that transmission is controlled. That means that the incidence of cases, the number of new cases that are happening is reducing, and that is reducing over a period of time. Second is that sufficient health systems and public health capacities are in place. That means that countries have the workforce and the ability to detect, to test, to isolate, to care for cases, making sure that the hospital facilities have enough beds to be able to care for patients depending on the severity of their symptoms, to have the right kinds of ICU facilities or advanced care facilities, respiratory support, having healthcare workers that are in place that can actually care for patients, to ensure that they have ability to contact trace the contacts of known cases, and they have the ability to quarantine those contacts in safe facilities. The third is to make sure that the risks of outbreaks in high vulnerable settings are minimized. We've spoken about some of these today. The DG mentioned prisons and detention centers in his speech today. We've talked about long-term care facilities. It's very important that there are systems in place to protect vulnerable settings. The fourth is that workplace preventive measures are established. We've also issued guidelines around workplace and the resumption of work in a safe way, so that certain control and prevention measures are in place, like physical distancing, for example, and that workplaces have plans to be able to rapidly identify cases and manage those cases. 5, the risks of imported cases are managed. Mike just described how with borders opening and people being able to move, that we and it can even be within a country, that we are able to find the virus so that the risk of the virus moving from one geographic area to another can be traced, can be tracked, and we can break those chains of transmission. And lastly, that communities are fully engaged. These are informed, empowered, knowledgeable community members who understand how the lifting of these measures needs to take place in a control and a slow way, and so that they understand that we may be able to lift them, we may need to impose them again, and that we are listening to our communities, we are working with our communities so that they know what role each individual has to play in controlling and suppressing this virus.